Well, good afternoon, everybody. Obviously, we're all gathered here for the coronavirus, and there are a couple of things that I just want to do in terms of introductions. For those that don't know me, I'm John Gargett, Whatcom County Sheriff's Office, Division of Emergency Management. And for those of you who've never been here, this is a joint facility operated by the City of Bellingham, Port of Bellingham, and Whatcom County. We will today have a presentation by the Health Department. They are the incident commanders, and I'd like to take a minute to thank John Walpers, Mark Reka, and Melissa Morin, who have been working pretty much, John, 24 hours a day for the last week. But I think it's appropriate to give them a hand. They've done a great job. Obviously, the dynamics have changed with this whole outbreak. The Health Department will get into all of that and talk about that. A couple of things that I do want people to understand is that this is being recorded. So any questions? We do have a runner. Where's our runner? Right in the back there. She's got a microphone and will request that you do ask through the microphone so it does get recorded. The speakers already know that they need to speak closely to the microphone. And we do have a number of people on the telephone as well. With that, I'd like to go ahead and you want to step on up?
Yep.
You ready?
Yep.
Okay.
Thank you. Good afternoon. I'm Judy Ziels from the Whatcom County Health Department and a member of the Incident Management Team. I'm sure you're well aware that this is a rapidly evolving situation. The public health system at the national, state, and local level are providing situational assessments, guidance, and recommendations based on what is known in real time. Since this is changing quickly over time, the information we provide today may be quickly outdated. In fact, based on the events over the weekend and today, we made significant changes to the agenda from what was originally scheduled last week. With this rapidly evolving situation, please be sure that you and your constituents are relying on sound sources of information to receive updates, such as the Whatcom County Health Department website, the Washington State Department of Health, or the CDC. While we have tried to limit technical terms in this presentation, we provided you with a glossary of terms for your reference. We want you all to have the most current information available because it is critical to our collective action and decision making. We are asking for your help to reinforce public messaging, work together to take the necessary steps to minimize transmission of the disease, and to develop necessary contingency plans within your organization in case we have significant spread of the disease and need to implement social distancing measures or other mitigation strategies. You will be hearing from folks from our incident management team and critical community partners involved in the response. While you are hearing from them, please consider how the information shared impacts you and your organization. We will be having a brief question and answer period after we've heard from all of the presenters. Our county executive, Satpal Sidhu, will now provide additional introductory remarks.
Hi, good afternoon, everybody. I've been told that this is part of my training program. Floods in February and coronavirus in March. I don't know what is in April, so we'll find out. Good afternoon. Thanks for coming. I think it really shows the importance that how many people are here today and how important this subject is, that this can impact our community or other communities so profoundly. Over the past week that there have been a lot of news we've been hearing, but now the news what we heard today is really accelerating what we are talking about, and all across the world. On Saturday, Governor declared emergency so that we can reach out the resources from the state agencies towards this problem. We know that this is a serious public health threat worldwide, and it's normal to be concerned. We know that some of the constituents have expressed concerns about how prepared we are, and are we ready to respond to this novel coronavirus in our county. This is why Whatcom County Health Department has invited all of you together in our commitment to coordinator partnership, planning, and communication throughout our county. We play an important role in preparing for and implementing strategies to protect and care for our community. I'm grateful and pleased to see so many of you here today in the spirit of this ongoing collaboration. Our local county health department is leading our county's incident management, and they will provide us with a briefing of the current situation, what we all can do in our organizations and as individuals to best protect our community. I also want to emphasize that as we plan for the possibility of local cases, we have many evidence-based interventions to reduce the impacts of the outbreaks of infectious disease in our community. We are able to draw on the planning and experience we have in responding to these disease threats, as well as respond to this new virus. Implementing of these strategies will require a collaboration and mutual support from all involved. Lastly, I want to remind us that we play an important role in reducing the stigma and discrimination associated with a disease outbreak. When it comes to protecting public health, we are all in it together. And allowing misinformation to spread, stigma to thrive, or otherwise ostracizing community members is counterproductive to improving public health and safety. We can each speak up if you hear, see, or read stigmatizing or harassing comments or misinformation. And we must all show compassion and support for individuals and communities most closely impacted and anyone who might be sick. Stigma is not going to fight this outbreak, but together we can. I'll now turn to Mr. Walpers. He is the incident commander, and he will start the briefing, and you will hear from other experts as well. And please hold your questions to the end, and then we can do that. Thank you very much.
Thank you all for being here. My name is John Walpers. I am the incident commander for the COVID-19 response. As you've heard, this is a rapidly evolving situation, and our team is working hard to stay up to date as we receive new information very frequently. The Health Department's incident management team is taking steps to prevent, contain, and mitigate the spread of COVID-19 and ensure that our local systems are prepared to best protect our residents. We are currently working 24/7 to prepare for the possibility of a growing situation in Whatcom County. The Whatcom County Sheriff's Office Division of Emergency Management is providing support for requests from the Health Department for outside resources from state and federal agencies. We greatly appreciate the efforts of all of our partner agencies, such as John Gargett and the rest of the team here at Whatcom County Sheriff's Office Division of Emergency Management, who have already stepped up to support the responses to this continually evolving incident. To help ensure the best possible coordinated response for our citizens and to continue to keep efforts in alignment with state, tribal, federal, and public health agencies such as the Washington State Department of Health and the CDC. All information communications will come through the Whatcom County Health Department Incident Management Team. Up until last week, our national and local responses have been focused on containment, meaning identifying those suspected of having or at risk of having COVID-19 and limiting their contact with other people. This included strategies to limit the number of people with COVID-19 re-entering the United States from affected geographic regions and isolating people within the United States who were most at risk of having or developing COVID-19. This weekend, more cases have been identified in the United States, and 6 deaths have occurred in Washington state as of late this morning. Several of the cases announced over the weekend have no known travel history or exposure to people who have been diagnosed with COVID-19. These cases are assumed to be ones of community spread. This signals that containment is no longer the most effective strategy. We are now moving to mitigation and personal prevention as our primary approaches. It is likely that there will be more cases of COVID-19 identified in the United States and here in Washington state, and that community-acquired disease will continue. It is the consensus of public health officials that it is not a question of if, but a question of when communities will have confirmed cases. It is important to remember that the vast majority, 80% of the illnesses around the world are mild with fever and cough. A much smaller percentage of cases are severe and involve pneumonia, particularly in elderly people with underlying medical conditions. There are currently no known cases of COVID-19 in Whatcom County, and we have 0 persons under investigation. There are 2 people in Whatcom County that are currently under public health supervision. These are healthy individuals who are in quarantine and monitoring for symptoms because they either returned from travel to a place known to have the spread of the disease or are a close contact of a confirmed case. As the situation is rapidly changing, so are the corresponding protocols for testing, treatment, and prevention. We will continue to follow the guidelines from CDC and DOH and update our practices as the guidelines are updated. Currently, there is no vaccine and no approved medical treatment to cure the disease. This means that the community-based strategies, which we will discuss further today, are our most important strategy. I'll end with a brief overview of the Health Department's COVID-19 response to date. We are educating the public on key ways they can prevent the spread of COVID-19 and are looking to all of you to help us share and reinforce these key messages. Disease surveillance efforts have been increased, and we are preparing for a rapid response should a confirmed local case be identified. We are providing regular guidance to our healthcare providers and hospital about monitoring and testing, and they are prepared for the potential of a clinical response to individual cases. We are working with community partners to be prepared to follow non-pharmaceutical interventions, such as canceling events and strategic closures in the case of local spread of COVID-19. Lastly, I want to point out that while this is a new disease, our response to it is not. We are building on the pandemic preparedness we and many others already have in place, as well as the guidance from experts at the CDC and DOH. I'll now turn it over to Cindy Hollinsworth, the Health Department's Communicable Disease and Epidemiology Manager, to talk more about the specifics of COVID-19 and our communicable disease response.
Good afternoon. My name is Cindy Hollinsworth. I'm the Communicable Disease Manager at the Whatcom County Health Department, and I'm also the Operations Section Chief for the COVID-19 incident response. I'd like to start by providing a brief overview of what we know about the disease. As John said, this is a new disease. We are responding to an outbreak of respiratory disease caused by a novel or new coronavirus that was first detected in China in late 2019. It's now known as COVID-19. The fact that it's novel is significant. This means that it is newly spreading among humans, so we have no natural immunity, and there is currently no vaccine or specific treatment for cure. It also means that there is a lot we don't know about the virus and the disease that we are continuing to learn about as the situation unfolds. I want to remind you about what we do know about COVID-19. The virus is thought to mainly spread from person to person through respiratory droplets produced when an infected person coughs or sneezes. Respiratory droplets can either be inhaled directly or by others or land on surfaces and touched by others. Disease presentation typically includes fever, fatigue, and dry cough, but there is a huge range in the severity of symptoms. People with COVID-19 may have no symptoms or develop mild, severe, or fatal illness, and the incubation period is 1 to 14 days. So we can see there's huge ranges. The vast majority of cases, about 80%, are mild in nature. Based on our current information, people who are older than 60 and those with underlying chronic medical conditions are at higher risk of severe illness. The current data available indicates that the case fatality rate is about 2% among those with laboratory-confirmed COVID-19. The period of infectiousness for COVID-19 is not yet known. Localized epidemics are occurring, and it is likely we will have widespread disease. COVID-19 does not appear to be containable, so goals are to slow spread so that fewer people are sick at one time. This will to buy time to develop treatment, antiviral treatment, and preventative vaccine, and to assure the provision of essential services while reducing the rate of spread of disease. All of this information indicates that COVID-19 is a significant public health threat locally and worldwide. At the health department, our communicable disease team is actively responding to this rapidly evolving situation. Our public health system response efforts at the national, state, and local level are focused on 4 main areas: continuing epidemiology and lab testing operations, supporting healthcare system readiness, identifying cases and close contacts, and emphasizing mitigation efforts. Locally, our team is staying up to date on current information about how the virus is transmitted and appropriate protocols for identification of confirmed cases and close contacts. Over the last 5 weeks, we have been putting this information into action and investigating potential cases, providing recommendations to our healthcare partners, and issuing guidance based on the information available. We are working with community healthcare providers to ensure protocols are in place to minimize risk to employees, staff, and clients. In the next few weeks, it is likely that we will have a confirmed case in Whatcom County. With a confirmed case in our area, we will notify the public and provide specific recommendations to the patient, their close contacts, and the community based on the individual case circumstances and the current guidance. To date, public health action related to specific cases has focused on isolation of confirmed cases, identifying case contacts, and providing needed health support. So a lot of information about testing out there. Testing is a very valuable public health tool that helps us to understand where the virus is active and the level of threat to the public in any given location. Currently, testing is not available for widespread use. Up until last week, all of the testing done in the United States was done at the CDC lab. And we now have limited testing capacity within Washington State at the State Public Health Lab, so we are seeing increasing testing in our region. Testing decisions are based on specific criteria as outlined by the CDC. These criteria change based on currently available information about the situation. Currently, testing is recommended based on severity of symptoms, history of travel to areas with significant community spread of the virus, or having close contact with a known case. It is understandable that people with common symptoms of the disease want to know if they have COVID-19. We do not, though, have the capacity, nor is it feasible to perform testing on all symptomatic people. At this point, the most valuable clinical use of testing is to diagnose people who are at increased risk of COVID-19 and those that are experiencing severe respiratory illness without another diagnosis. I'm now going to turn it over to Dr. Graves Stern, our local health officer, who will go into detail about the community-based actions.
Thanks, Cindy, and good afternoon, everyone. I'm Greg Stern. I'm the Whatcom County Health Officer, and I want to follow up on the themes that we've been discussing and talk more about the personal and community-based actions we can all take now to slow the spread of COVID-19, which has obviously arrived in our region and has likely been circulating for weeks. At this time, we do have a full spectrum of personal and community-based non-pharmaceutical interventions. You may hear them referred to as NPIs in technical discussions. And these are things we can do to help slow the spread of the disease. And there are some that we can implement now and others that may be used as the situation changes. So these include personal and community-wide measures, isolation and quarantine of cases and contacts, and community-focused measures that include closures and other restrictions. This is our toolkit. We don't use all of them all the time, and there's some criteria that we apply and considerations when we use them. So the effectiveness of each intervention is based on the situation at the time and new knowledge about the virus and its characteristics. So I want to emphasize that each intervention or strategy that we use has other consequences that must be identified and addressed. So these include impacts on the availability of essential services, on access to food, water, utilities, all the things we still want to keep society going even as we try to prevent infection. And that's a tough balance at times. It also has economic impacts and social and behavioral health impacts. And we want to especially pay attention to the disparate impact or burden on people that already experience adversity. So in deciding how to implement interventions, especially those that may be mandatory, we consider equity and individual rights. We consider our public and partner engagement, culturally and linguistically appropriate strategies, and try to ensure effective coordination across government, business, and community organizations. We are all in this together. We'll be working all week with community leaders to consider their specific needs and information in an effort to maintain essential services and functions while we apply measures to slow the spread of infection. Our collaborative work with these leaders recognizes that they know their systems and constituents best, and we want their full participation, knowledge, and experience in balancing those needs and in protecting our community from COVID-19. I'm not sure if the slides are up that list 13 non-pharmaceutical interventions. Somewhere we have a list, and they're kind of ranked in order of kind of things we can do now on a more, I'm sorry, my phone rings in my ears. I'm just going to turn that off. Let's see. They're ranked in order of increasing restrictiveness and impact. And the first set are those that are least restrictive and should be used now and as broadly as feasible. You've heard about them repeatedly over the past several weeks, and I want to reinforce their importance. This is wash your hands with soap and water. Use hand sanitizers when you can. Do it frequently, especially if you're touching public surfaces. Use a tissue when you're coughing or sneezing, and wash your hands afterwards. increase the distance between yourself and others when feasible. I don't know how many of you I greeted that I knew that we were about to shake hands and we did the pandemic elbow bump. So practice that. And you'll stay safe. Clean, frequently contacted surfaces. This is something not only individuals can do, but organizations could start saying, is it feasible for us to do this more often so that we reduce, if there is viral, viruses, respiratory viruses on there, including possibly COVID-19, let's reduce the risk of exposure to it. And it's very important to stay home for the duration of a respiratory illness. This is to protect others. You're going to have the coughing and sneezing makes droplets. It's when you're symptomatic, you're more likely, you're producing more of them. So wait till the symptoms are gone, and then, so don't rush in to do your work while you're still potentially spewing bugs. The next series of interventions are responses to ill persons and their contacts. So we isolate and quarantine now to minimize the spread for those most likely to be infected and their close contacts. We isolate sick individuals to reduce transmission of infection to others, and we quarantine healthy individuals who are close contacts of cases and who may be infected and this is to prevent transmission of virus if they're in the early stages of illness, if in fact if they do develop the disease. The last group of interventions are community focused, and these address large gatherings and travel restrictions. These include voluntary or involuntary event closures, like canceling mass gatherings to reduce disease transmission, or we may make recommendations for gatherings that have to occur for personal infection prevention at these events. Voluntary or involuntary public and private targeted facility closures, including schools or businesses. So we're talking about when would we close an event, when would we close a school or a business, and this is a tough balance. Another intervention would be travel restrictions. These tend to be the ones that are directed by the CDC and the Division of Quarantine at that level. The health department has several roles in these interventions. We can educate and encourage infection control measures that people can do voluntarily, can take that information and apply it. We also have the ability to mandate measures such as isolation, quarantine, and closures. This legal authority is established by state laws and rules and will always be done in consultation with our community partners, leaders, and affected organizations, because we need to balance this decision on whether it's going to be effective and whether the benefits outweigh the consequences. Community leaders and partners can start to apply many of these infection control measures now, and we ask you to think like we do. How can we balance infection control with continuing operations and providing essential services? That's the dilemma. There's no easy answer. We're available to problem solve in this decision making. And I'd like to discuss some examples of some of the types of plannings and adjustments that you can apply now or can be applied now. So employers and businesses can support their employees and their customers to slow transmission. These include promoting staff policies that reduce infection risk, such as social distancing on site, telework options, attending meetings by phone or web to reduce large gatherings, and properly using sick and leave policies. Consider employee needs for family care responsibilities so you can reduce the barriers for employees to continue to work. Provide customers with hand sanitizers upon entering the premises, and provide masks for those with symptoms, or instruct them to return home and contact their healthcare provider. We don't recommend masks for people that don't have symptoms. They really are not that effective for preventing you from getting it. This is really to stop spread. And the masks that are effective are the N95 level masks that healthcare workers use. those are fit tested. They can be used ineffectively, and as people start hoarding those, there are fewer available for the healthcare workers that you need to be able to stay safe to take care of us in a community. So avoiding hoarding, using these things appropriately, following best advice is really, really important right now. Now I lost my place. Okay. So it's also important that employers and businesses make continuity of operation plans that include responses to widespread infectious disease. A lot of folks have been thinking about earthquakes and other natural disasters. We need to think, how do we continue to keep our community going and our businesses going during events like this? We in public health work with our community partners and the public to reach the goal of protecting public health and safety, and we cannot do it alone. And I want to extend our thanks to all of you for joining us and working together as a community to take on this challenge.
So thank you, Dr. Stern. I just have some last talking points that I would like to share with you. Again, I want to remind you that the Whatcom County Health Department has activated a COVID-19 incident management team. The contact information that you see on the wall there is for key staff for your information. The Whatcom County Health Department is meeting with key community stakeholder groups all throughout this week to discuss the decision-making that would be necessary in the event that we may need to implement community measures such as canceling large public events and strategic closures to reduce transmission. Key stakeholder meetings that are currently scheduled are with healthcare providers, with schools, with child care centers, and with long-term care facilities. And now, I would like to introduce Mike Hilly, the EMS manager.
Thanks. Good afternoon. My name's Mike Hilly. I'm the EMS manager for Whatcom County. And after hearing what happened, through the weekend, we're certainly concerned about first responder in response to an outbreak here in Whatcom County. However, we haven't seen that yet. But our first priority is obviously taking care of our first responders, and so we're putting, upping protections for first responders when they go in facilities, and just to be on a high alert for, fever, infection, cough, and that type of thing. However, EMS deals with this type of call every single day, so they're very difficult to sort out. Most often, you don't find out till after the fact that you've had this type of exposure, and then we follow up with plans on that. So. Going into these calls, our providers are using a high level of respiratory protection, trying to identify these calls and dispatch as they come in. And if the situation does get worse, we're prepared to put in some precautions in dispatch, as well as our response planning on how we would take care of patients that may fit that description of being exposed. And it could be harboring in place. It could be an alternate destination for that particular patient if they're not sick at that time. However, if a patient is truly sick, respiratory distress, respiratory arrest, of course, cardiac arrest, EMS is going to do what they normally do. They're going to take care of that patient as best they can, and then we'll deal with the exposures afterwards. But we are concerned about staffing in the future. If we were to have an exposure, we're concerned about transportation and how many patients a hospital could take in at any given time. So we're working through those plans for the next week if we should ramp up on any of that. But right now, fire department operations are normal, heightened level of awareness for sure. We haven't seen any clusters, so I'm able to see in our record management system, our patient record management system, if we are having clusters of flu or high fever coming up. We're not seeing that yet in any of the nursing homes, any of the facilities, so they are randomly around the county as we've taken in flu calls over the last I think month is where we ran that analysis to see where these flu calls were. So we're not seeing clusters yet in the EMS system. Everybody is pretty safe and healthy right now, but we are planning if we do have an outbreak and we have to protect our responders. So, any questions on that at all?
We're going to hold on questions till
Okay, great. Thank you. Yeah.
Switch seats with you now. So we're now going to hear briefly from Ann Deacon, our Human Services Manager.
Good afternoon. We have a number of community partners who work with people who have vulnerabilities, barriers to access to sanitation, hygiene practices, certainly some people without homes with running water. I will tell you that our partners have, for the most part, procedures and policies in place to address these issues that they've had for quite a while. A number of them are already initiating those policies and procedures. I think that we have the ability in many of those organizations to isolate people who need to be separated. And we have a couple challenging situations as well if it comes to that. And so creative thinking has already begun to happen to make sure that we can address to the greatest extent possible people who may not be able to have the ability to care for themselves without support. So our efforts right now are to make sure that our partners have what they need, not only in terms of information, education, resources where we can connect them to others, and we will continue to be in contact with them on all of those things. I think for us, again, these services that are provided by these organizations are critical to the ongoing care and well-being of our population. And that, as Dr. Stern said earlier, we really need to balance the need to continue those services along with the need to minimize the transmission of infection whenever possible. So we are actively working with them, and you have community partners that are very much dedicated to the health and well-being of their people.
We're now going to hear from Robert Taylor of Peace Health.
Good afternoon. My name is Robert Taylor. I'm the Emergency Management Coordinator for Peace Health Northwest Network, which includes Skagit, Whatcom, San Juan, and Ketchikan, Alaska. Primarily here to represent St. Joseph Medical Center and our Peace Health Medical Group facilities here in Whatcom County. Over the past 2 months, Peace Health has been fully invested in exploring the need to respond to coronavirus if and when the day does it come. From a systems perspective, we have implemented many changes related to our screening processes, identification of patients from the get-go, whether it's in the clinical setting of reviewing our upcoming appointments, or in the hospital and frontline settings of reviewing the most up-to-date screening questions and making sure that we're asking the right questions early on in the care process. At this point, Peace Health is fully prepared to meet the needs of our communities. This includes staffing, resources, and our approach to care as it pertains to coronavirus and any other respiratory-driven illness. At the moment, there are no confirmed cases in any Peace Health facility here in Whatcom County or throughout our 3-state organization. All of our care teams are operating with an abundance of caution, ensuring that they're in the most appropriate PPE to keep themselves safe, but also to ensure that if we do have a case within the facility, that patient is being treated in a way that keeps all of our other patients safe as well. From this point forward, and as we have been doing in the past, we've been remaining situationally aware of anything changing throughout the nation, the state, and our local level. And I'm proud to say we've been fortunate to have a strong public health team really driving this boat for us to keep us on the right track and revalidating all of our own internal plans and procedures. But past that, we're completely confident in the road moving forward and excited to see what happens with our plans and how we can care for our communities.
And then John Gargett going to come back and offer a few more remarks.
Somebody's phone?
Yes. I left it on the seat. Thank you.
Well, thank you again, and thank you again to the Health Department, Whatcom County Health Department, for your work and leadership on this. Our job in the Sheriff's Office Division of Emergency Management is to look beyond or if something were to occur and begin to make those contingency plans and put them in place. Beginning this week, one of the things that we're doing is scheduling appointments with each of the Whatcom County departments to review those contingency plans, and we urge all elected officials in all jurisdictions to begin doing the same. We do have a template, which I'll be happy to share with any organization to fill out, and that includes things such as lines of succession. We certainly saw this weekend in Iran that the vice president of Iran, as well as the head of their COVID task force, both became ill, and that is a great example of how even those that are at the top and or in management positions may themselves become victims of a particular event. So we're going to want to look at succession planning within each of the departments, and within each of your cities or organizations you should be looking at those plans. Those are very important things, and again, happy to go through that with anybody in addition to the Whatcom County departments. For those jurisdictions within the county, be happy to meet with your city staff as well to go through those and assist you in that process. That includes things such as going ahead and exercising and testing things like remote work environment. So for example, just because there are things such as WebEx or GoToMeeting or other solutions, has that actually been implemented? Do you actually have a license to do it, and would that actually work? Those are some of the very small details, but things that are important to consider. In terms of things beyond that immediate planning, there are some things that all of you do need to be aware of. There is a state incident number, and as you know, the governor has made a declaration of the state of emergency, and that number is 20-0265. And the reason I bring that up, and again, that number is 20-0265, is because now the state of Washington has requested that all resource requests, whether it be, as we were discussing earlier, for N95 masks or other equipment, that those be routed through our office and submitted to the state so that the state can be our agent in acquiring any or all resources which we need in order to respond locally. Additionally, while this is not a presidential declaration, and it's hard to know whether it will move to a presidential declaration at this point, one of the things that number also should be used for within your organizations is the tracking number for all expenses that you might be incurring as a result of the response to COVID-19. As you know, for the floods most recently, our office did send out a request for damage figures, which include overtime. That's something, any equipment purchases, things like that. The state will be wondering, not too near distant future, about what kind of costs people are incurring. So please, if you can, begin to track all your expenses against that number, or at least be prepared to provide summaries of those expenses back to our office on that. Again, as I mentioned, all the resource requests for anything you might need should now come through this office, if they're not available locally, through local resources, so that we can put them all together in a larger request to the state of Washington. Finally, again, all information is coming from the Public Health Department. We appreciate all the help and support of the Health Department and everything they're doing. We will be continuing. Our office is responsible for the public safety officials' updates. We will coordinate those updates with the Health Department so that we are in complete sync in terms of what goes out, but you will see those as well in addition to what the Health Department is providing. So with that, I'll turn it back over to you.
Thank you. I know that was a lot of information that we sent out your way. We will have a time for brief questions, and just want to remind you that these slides will be on our website, that this is a rapidly evolving situation, and so please check really good sources of information, our health department website, the Washington State Department of Health website, the CDC, when looking for updated information. And because we have some of our critical responders here with us, we are not going to have an expansive question and answer time, but your questions are really important. And so we will get through a few of those at this time. And also, if we aren't able to answer your question, we'll be taking that information and making sure that we get back to you and also include it in our question and answer bank. Kathleen Roy, our Assistant Director, will be a contact for you if there are questions today that don't get answered, or if you want to contact a liaison within the Health Department to answer your questions. So because this is being recorded, we're going to ask that all questions come through a microphone. Amy Rydell is available with the microphone, so we'll be glad to take any questions you may have at this time.
Hi, my name is Jacob Peterson. I'm an environmental journalism student at Western Washington University. My question is, what is Whatcom County's plan to make sure infected people that get health care? What is Whatcom County's plan to make sure infected people get health care that don't have access to insurance or adequate savings to get treatment?
Well, like all the other issues that affect us, that's another dilemma. And we do have some healthcare, some medical safety nets in this county, but there is a problem of people accessing healthcare. As far as the COVID-19, there are community health centers, CMAR and Unity Care Northwest, that are available for folks without insurance, low-income folks. The emergency rooms do provide care, and sometimes that's with people that don't have insurance. There's some charity funding for that at times. So it's not, we don't have a complete system in place, but there are resources there, and we'll work to help direct people to what is available.
Hello, Seth Fleetwood, Mayor of Bellingham. I know the Bellingham Municipal Code has provisions that relate to the powers of the mayor to order closures and things of that nature. I'm sure all the corresponding codes empower their mayors or the county executive accordingly. And this relates, Dr. Stern, to your reference to the list of 13. I know 10 through 13 talk about getting to that stage where we have to consider ordering social distancing and closing down public events and whatnot. Do your teams have powers and processes, protocols in place that would result in recommendations being made to people like us to make recommendations on when to utilize those powers?
I think rather than having specific protocols and triggers, if any of us are proposing or seeing a need for that, I think we'll be convening with the county executive, the mayors, to discuss it, as well as with other organizations, and using the tools that we have with our legal authority to do closures. So I don't have a specific protocol that says if this, then we close, because those are really situational. I don't want to commit to closing schools if there's a case, because it may not be effective and it would have a lot of cost. But if it's an effective way to stop or slow transmission, then we would certainly be bringing that up. So our legal authorities are our tools, but in using them, we work together with you guys.
Michael Lilliquist, Bellingham City Council. I have a very similar question at an earlier level in that hierarchy when it comes to recommending publicly that people voluntarily close events, that people voluntarily institute social isolation. again, what sort of guidance will you be giving so that public bodies like cities and counties can start putting out that recommendation, those voluntary measures? How will we know when that goes out, or do we just let health officials send those messages out?
I think as this develops, we're going to have need to have coordinated communications and recommendations so that we don't have one group saying we think this is a good idea that we shut down an event and others saying we think it's an okay thing to keep our event going. So that consistency and coordination is real important. So I think the first step is the consultation and the decision of whether or not it's likely to be effective, and then go from there. So I wouldn't recommend people or groups, city councils, make those proclamations in a vacuum. I don't know if that answers your question, but.
I don't want to make it a vacuum. The question is, how is it going to be filled so we know?
I think what'll happen is as we gear up, we'll be coordinating with our incident management team so that the strategies are coordinated and we work in a more unified way rather than a bunch of separate organizations dealing with COVID-19 on their own. Does that answer? I guess I'm not clear what the question is, but we can talk about it more later.
And if I may just add, communication and collaboration is critically important to our response. And as Cindy had said, we're working closely with our Department of Health and the Centers for Disease Control. And so depending on the prevalence of disease in our area, in our region, then that will give us a different criteria to make decisions on. And so it isn't that there are simple protocols right now, but this is going to be an emerging situation and require ongoing consultation and collaboration. And if we get to that point, what I'm hearing Dr. Stern say is that he'll consult with the people that are involved, or if there are recommendations that are more widely applicable, then we'll be putting that information out for our full community.
Tyler Bird, Whatcom County Council. What I'd like to know is what severity of cases are we prepared, or what number of severe cases are we prepared to currently handle within, say, the next 7 to 10 days when it comes to medical or providing medical attention, specifically people who will require hospital stays, as well as the percentage that will require ICU stays?
We're going to have Peace Health come up.
I'm going to do 2 steps. The first step is do we have predictions of how many? And we don't. We know that there's a range of severity, so I'd anticipate that about 20% or more of the cases that do develop are going to require hospitalization, and a smaller percentage of those will require ICU care and ventilators. So it's hard to say from today, where we have no cases in Whatcom County and some in the region, that within the next 10 days we will have a larger number. But we do have flexibility and measures we can take to maximize our capacity to take care of folks and to spread, even transfer patients to other areas of the state that don't have, that aren't impacted at the time. But I'll let Robert talk about patient kind of transport.
Yeah.
Thanks.
So as Dr. Stern really reiterated there, as this develops and changes, so will our care practice, where and how we manage our patients within our facilities. It is not a hard set number with any of our buildings, the number of patients we can handle, because we make changes for other patients, place them in different facilities, transfer them throughout our communities as we take on the burden here locally in the event of a coronavirus spread. However, we've been planning for these types of contingencies not only this year, but the same types of approaches with previous outbreaks in our communities for the past 2 decades. And our facilities are very flexible in how we manage these types of patients, both internally and with the recommendations from our public health partners.
If you'd wait for the microphone.
So my name is Cislina Ledbetter. I'm at Counseling, Health, and Wellness at Western Washington University. And at any given, we're a city in unto ourselves. And so any given day, we have maybe 14, 15,000 students on campus and between 4,400 in our dorm rooms. So when I think about least restrictive measures and social isolation or distancing and telemarketing, I'm curious about what your recommendations might be, given that we have about 2.5 weeks before the end of our semester. So as we think about balancing risk versus the academic progress of our students and the services that we provide, what are your thoughts about moving forward and what way we might be thinking about it? Because we're literally doing it right now, just like everybody else. But we've got these, all of these students that we're thinking about every day and how to best sort of, navigate the difference between continuing classes, business as usual, versus do we kind of do something different?
I think that's an excellent illustration of the dilemma that every organization or system or institution will face in making these decisions. I will say that there is a specific set of guidelines for higher education on the Washington State Department of Health website. And don't know if any of you have any specifics that you'd like to address, but it's a great question, and we'll certainly bring that in and continue to work with you. Yeah.
Kathy Kirschner with the Whatcom County Council. My question is, how are we notifying the public of what is going on and what is happening and what they can be doing to help us by, following those first 6 steps that we're talking about: washing hands, social distancing, not going to work when you're sick? Do we have a communication strategy around that? Are we putting it in the newspapers? Are we talking to schools to start talking to students? Are we putting it on the radio? I think, just wondering, there's a lot of us in this room, but not compared to how many people live in Whatcom County. It'd be good to have some strategies for getting the word to our folks.
Yes, communication is one of our key roles and our key activities that we've been focusing on. We have put out media releases. We will continue to do so. We're working on frequently asked questions on our website. We are fielding a lot of telephone calls and really encouraging people to get their information from the best sources possible. And we've been monitoring Facebook and Twitter, Nextdoor, and providing messages on those platforms as well to try to disseminate both sources of really key and good information, as well as answering particular questions or providing information and guidance. Yeah.
Hi, Dan Hamill, Bellingham City Council. We are statutorily bound to follow the Open Public Meetings Act, as all councils are. Is there a protocol that will allow us to continue with governing, basically, if this thing gets so dire that we're not able to meet?
It looks like that's a great question that we'll have to get back to you on. Yeah.
Michelle McDaniel, environmental journalist at Western. My question is, what are the psychological implications of social distancing ourselves, and how will we work together as a community if we're socially isolating ourselves?
No, I'm watching your how frightening the thought is. Social distancing is a technical term for doing things to reduce the space between people. And the challenge is, how do we stay connected while we're being distant in order to stop infection? And that's another one of those dilemmas. So if we can do things online, if we can be in rooms but be 6 feet apart, even just sitting farther apart not shaking hands but bumping elbows. These are ways to break the chain of transmission, and the challenge is how do we implement those and still stay connected, keep our community going. These are challenging times. It's not going to be business as usual, but we do need to maintain that connection. And that's part of why we need to fight stigmatizing and making judgments about people, running out of fear rather than knowledge about what's going to be effective and what the consequences are. So this isn't a matter, I know we talk about some of these mandatory closures and mandatory things. Those are really last resorts, and they really have to be effective. Their effectiveness and benefit has to outweigh the negative consequences for those to be implemented. But that is the bind, and it's more than just practical stuff. There's some real emotional issues about what does it mean to live in fear of getting infected or infecting others. So we get it. It was a good question, and I wish I had an easy answer. So.
Red Brown, Whatcom County Council. I've got three questions. The two are related. What are we doing from a perspective for the inmates in the county jail? And as we're well aware, the existing facility lacks the negative pressure rooms that, say, Skagit has. But you've got a population that's in very close quarters and may have been drawn from an environment where there was not the protocols towards hygiene. And the second part of that question is we've also got a large homeless population who are both don't have access to the same hygiene services and also are more prone to illness just because of the conditions they live under. So I'll let that question be answered first, and then I got a third one.
Does anyone have specifics?
With respect to the jail, and also I want to return to your question about what is the continuity of government, which you raised before, so that, for example, one of the scenarios we're using is what if we had somebody become infected, say, in one of the public areas of the courthouse, and that, for whatever reason, or several people did, required the shutdown of the courthouse. How would we continue the ability for you to continue to have county council meetings, for example? They may be virtual. Those are the things that we're looking at right now in the development of the plans for the contingency plans. So just wanted you to know that. With respect to the jail, this morning I did meet with Wendy Jones on that, and she was meeting with her nurses and with her medical staff within the jail, and they're actively pursuing exactly what and how they can do this. She did remind me that with the H1N1 outbreak a number of years ago, that they had some pretty good protocols that worked out fairly well. In fact, Greg, didn't you work a little bit on that with them? Do you remember?
I don't remember the details.
Yeah. But that is being actively looked at right now, including if it did become contaminated in the jail, how would they be able to move patients and where would they move them to? Is it to the work center? Is it some release? So that is being actively worked right now.
And then my third question is this, is if someone is exposed to it and recovers, are they a good candidate and can they safely work as a caregiver for those that are suffering from it?
I'll leave that one to.
Let me address your second question before we get to the third, which is the homeless population. Clearly, difficulties in terms of access to water, soap, things that can help prevent infection is really critical. I will say that we have outreach teams that are really good at providing materials to help with sanitation and education. The Lighthouse Mission that has a drop-in center has really strict protocols in place. They steam clean their mats every night. They wash all their linens in hot water every day. They disinfect their services numerous times during the day. So they are very strictly adhering to the policies they have in place to make sure that folks who may not have any other access to clean, safe environments will have that. So we're working with them on a regular basis.
And in regard to both infectiousness and immunity, we don't have a lot of information yet, but there's more and more information we're developing. Some of it's based on what we know about the other common coronaviruses and the novel coronaviruses, SARS and MERS. My understanding is that if someone is infected with a particular coronavirus and recovers, they develop immunity. It doesn't seem to be lifelong, but it may be for several years. We don't know specifically how this virus works, but we're with the assumption that it would be a couple of years. Folks that have been infected and then recover would be relatively spared from severe, from reinfection for a while. This is what one of the plans around the H1N1 pandemic was recognizing that too before we had effective vaccines. So it's one thing to be considering as we make the plans and integrate that information as we get it. Our assumption right now is that the other thing is that we should be developing antibody tests, serology tests to check for evidence of prior infection, of the body's immune response to being infected. And that'll help us track whether people have been infected and have recovered. We may be able to identify protective levels of antibody that would be able to, that'll give us more information. Right now, if people are infected, they are tested until their tests are negative for the virus, and then considered safe for release from isolation. Or that's at least what happened with that first case in Snohomish County. He was in isolation until he had consecutive negative tests.
So I know that several of you still have questions, and as I said, Kathleen Roy will be the conduit for those questions. I'm sure you understand we want to get our key personnel back to the active response and making sure that our community is prepared as well as it can be. Please do continue to be informed and continue to prepare, but not panic. And really appreciate you being here and your attention and your ongoing partnership as we address the issue at hand. Thank you.